You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, it's the new liposuction. In fact, it's FDA cleared to literally kill fat cells by freezing them. And with us, we have an expert on the topic, Dr. Grant Stevens. Dr. Stevens, welcome to the program.
Thank you, Randy.
Is that true? So it freezes it?
Absolutely.
And then
it's non-surgical, it freezes the fat cells die, and you get thin.
Okay, good. Now, we've wanted you on the show for quite some time. You are all over the media. Is that right? I mean, you've been on just about every single talk show. Dr. Phil, the doctors.
I've been very fortunate.
All those. Now, for people that don't know you and your center, who's your typical patient? Because you do more than just CoolSculpting.
Absolutely. We've been in the marina for 30 years. We have marina plastic surgery, and we have a full spectrum of aesthetic and cosmetic procedures, both surgical and non-surgical.
And you're also the inventor of this Manland.
Yes, Marina Manland, where a man can feel good about looking great.
What is that, by the way, Manland?
It's a special area that I built where men can feel comfortable about coming in and doing non-surgical things and even some small surgical things. It's built for the needs of a man, and I describe it as guy-friendly, but not gal-unfriendly. So women even come into Manland just to have a good time.
All right, now we've invited you on the program to talk about this CoolSculpting people say it's sweeping the country, that it is the new thing right now.
That's right.
Is that right?
That's right. We started doing it in 2009. We've done over 13,000 procedures. Last year we did 5,000 CoolSculpting procedures.
Now you're the largest center that does this.
We are.
Right?
We have 9 CoolSculpting machines in the marina at one location, and we are the busiest and the largest in the world.
Does it work?
Oh, does it work? Well, do I have stupid written across my forehead?
Okay.
I can see buying 1 or 2, but I have 9 machines. You bet it works.
I mean, because when I read through like your website, it does sound too good to be true. Because no surgery, no needles, no downtime. Mm-hmm. But the question, does it work? I mean, that's a fair question. Do patients ask that?
You know, I asked that too. And in 2009, when they told me they could freeze my fat and I could get skinny in an hour treatment in over 3 months, I thought, oh, come on. How could fat possibly be sensitive to cold? What, am I going to jump in a cold meat locker and get skinny? So I had the same skepticism. But let me show you the first patient I treated.
All right.
Me. Here it is right here.
Okay.
That was me, 2009. So now it's come almost 6 years ago. That was one treatment. Where'd my love handles go? And here, after a second one, a year later, I got a little greedy. This is where I started, and that's where I ended.
And that's your back.
I can take my shirt
like
off right now and show it to you. What?
I mean, that's like an 18-year-old.
It's unbelievable.
I mean, it's smooth.
I did this with about 20 people before I believed it. And that first year, I only did 271 treatments. And then each year, I did more and more. By the third year, I had done 1,800 treatments. And then I had 4 machines. And now the subsequent last 2 years, I've accumulated 9 machines. As I mentioned, we did 5,000 treatments last year. Let me show you the second treatment I did. She's another great friend of mine, a patient. I had done some surgery on her before. And one of the frustrating things is she wanted her back done. A lot of women complain about this bra fat. Mm-hmm. And she had liposuction already when I had done some breast surgery on her and so forth. But the skin was still redundant over her bra, and she had extra fat. This is one CoolSculpting treatment. Notice the skin is tight, and notice the fat's gone. And here she is again on the 3/4 view. Every woman I know from 35 to 65 complains of this area on their back. They say, it sticks under my bra or my bathing suit. What's with this stuff? And they grab it. CoolSculpting is unbelievable there. It gets rid of the fat and tightens the skin.
Okay, so I understand how it works because I haven't really seen the machine physically. So it grabs, grabs onto the fat.
Okay. Well, there are 4 or 5 applicators that suck in the fat in the skin, and we'll go over those. Okay. But there's a new one called CoolSmooth that I helped develop, and it's FDA approved now, and it goes on the lateral thigh or the inner thigh. So the outer or inner thigh, and it doesn't have to grab it in. It can be just applied topically. But in general, if you can hold on to it, if you can grab it, you can freeze it.
And when you freeze it, it does what?
Okay, so you freeze it for about an hour. It's a special temperature that freezes the fat but doesn't hurt the skin or the bone or the muscle or the nerves or any other structures, because you know if you make things too cold, that wouldn't be good, right? That's frostbite. But if you don't make them cold enough, nothing's going to happen. But there is a temperature that took 10 years and $80 million of research to prove. And that temperature is the temperature that CoolSculpting freezes the fat at.
And now these fat cells, they
Yes,
die.
they
And
do.
they don't come back. I mean, that's
So let me tell you
like
about that.
lipo, right? I mean, same kind of thing.
Well, the difference between lipo is we suck them out and we throw them in the garbage, and they're gone.
Okay.
Okay? They can't come back because they're history. But with CoolSculpting, we assault them with this cold. They die, and it takes them about 3 months to be entirely eliminated. People ask me how fast. It's about like eating a French fry every day. You eliminate them in the natural digestive tract, and over time, these fat cells are eliminated. They can't come back. They're just like lipo. They're history. Now, you can out-eat the procedure. If you go out and pig out and gain 50 pounds, you're going to gain 50 pounds. It's going to go somewhere.
Okay.
But it's not going to go where we froze the fat.
So you could wipe out love handles. I mean, like, what's the best area to take care of on men and women? Like, what's the number one area that they want?
Well, you know, we can do it all over the body now. But men hate their love handles, even though they work out. They work out really hard like myself, and we can't budge the love handles. Let me show you Beto Duran.
Okay.
Beto Duran works at ESPN. He's allowed me to show you these.
Okay,
and he's
good.
on his blog. He talks about this all the time on the radio. Here he is. His love handles bothered him. You see his before and after. Beto was blogging while he was being treated. He lost about 4 inches. Now, I lost 2 inches, and the average guy loses 2 inches, and that's all I can
You say
expect.
he says on his show that
4
he lost
inches.
4 inches.
Yep.
But he's not allowed to, you say.
Well, I've asked him not to. That's a little too much.
Okay.
He had a terrific result. Average guy about 2 inches. It takes about 3 months to 4 months to see the change. Now, it's a bell-shaped curve. There are some people that lose 1 inch, and there are some people like Beto who lose 4. Average about 2, or another way, about 25% of your fat per treatment. Now,
Okay.
we used to say 1 treatment, and that's good. 1 treatment's good, but even I had 2 treatments. I wanted more. I got greedy, you know. Oftentimes I say, who here doesn't have an inch of fat they'd like to get rid of? When I'm speaking publicly,
Yeah.
you know how many people raise their hand? Nobody. Unless there's some cachectic distance runner, right? Who here doesn't have an inch they'd like to lose?
That's everybody.
Everybody. Then I ask, okay, free liposuction. Who here wants liposuction tomorrow? Very few hands go up.
That's a good point. Even if it were free, people don't want lipo.
That's the rule for
That's me, by the way.
That's CoolSculpting. We have a population of people who want to look better, look thinner, but they don't want the anesthesia, the pain, the bleeding, the downtime, the recovery, but they want to be thin, right?
Yeah.
Come in and spend an hour or 2 at Marinoplastic Surgery. We'll freeze the fat. We have 9 machines. We can do 4 at a time.
Like 4 different areas.
Absolutely. So most offices have 1. We have 9. So let's say a guy comes in, he wants to have his abdomen, his love handle, and his chest. We'll get back to moobs in a moment. But we can do 3 areas at once. So in 2 hours, we can do 6 areas. They go home. Over the next 3 to 4 months, they lose 25% of their fat.
Liposuction is still the number 1 procedure.
Yes.
Do you think this may replace it someday? Because you're not a big fan. You told me in the green room, not a big fan of liposuction, doing it personally.
Right.
But you like this.
Yes. Now, I'm a big fan of liposuction when I'm doing tummy tucks or I'm doing facelifts or I'm doing other associated procedures because I'm already doing surgery and I do liposculpture. But in terms of standalone body contouring, we now can do as much with CoolSculpting as we could do with liposuction. This is not only as good as, Randy, this is better than lipo in many areas. I can show you results that are better than liposuction. Let me show you, for instance, Helen.
All right.
Helen's legs here were done 3 times with liposuction elsewhere, including out of the country. She came to see me, and with CoolSculpting, look at the improvement of her legs. This is non-surgical.
So it like smoothed it out.
Absolutely. Absolutely.
I mean, is that one of the advantages with CoolSculpting? It's a smoother look?
Well,
maybe?
it freezes the fat. It leaves the other stuff alone. So if we apply it properly, we can actually smooth contour irregularities that have been left from bad liposuction.
You know, anticipating, knowing you were going to come on the show, I asked around, and a lot of people said, I don't know if that works. Mm-hmm. Is that, I mean, if they knew that it worked,
Right.
right? If they knew the truth about it.
Well, everybody's a skeptic at first. I was too. I mean, come on. When you go to the mountains, you don't lose weight. When you get in a cold meat locker, you don't get skinnier, right? So I thought, how can this possibly be true? But it turns out the company did 10 years of research. They froze a lot of skin, and they got too cold. And then they didn't get cold enough on a bunch of animals and then subsequently tummy tucks. And they got this temperature where our fat cells, those adipocytes, are uniquely sensitive to that cold. And once they got that, they could reproducibly and reliably lose the fat and lose the bulges. It works. I was the first one. We've got 13,000 since. I wouldn't buy 9 machines if it didn't work.
You love it.
Well, it works. Guys say thank you. Women say thank you. You sit there. And the other thing is we can do other things at the same time. So imagine this.
Right.
You're sitting there for 2 hours. You've got some love handles. I saw them.
Okay.
You do your love handle.
Everybody does. Right?
Everybody
if
does.
you're over 40, you got a little bit.
So you give me an hour.
Okay.
We do your love handles. We do both at the same time, just 1 hour, okay? And while you're doing that, we do a little Botox up here, maybe a little filler here, or a nice hydrofacial. At the same time, you're watching television. I mean, and then you get up, you leave, and 3 months later, you've lost 25, 30% of your fat. Your belt's, say, an inch looser.
Are people saying that they're losing like a dress size or?
I hear that all the time.
Or men?
1 or 2 dress sizes. Men are kidding me that I should pay for their bill to have their tailors.
That's the most expensive thing about it?
Alter their pants and their jackets and so forth, yeah. No, it's a terrific procedure.
Okay, so you brought more photos.
I did. Let me show you a couple. Well, first of all, this is amazing. This young woman has had 2 children. I want you to see it's the mommy tummy. Everybody's seen that before. She loves her children, but doesn't like her tummy, right? And here she is on 3/4 view. Now, this is a patient that I would normally do a mini tummy tuck. An incision, like a cesarean section incision, get rid of the extra skin, and suck the fat out. Okay. This is what I would do. She didn't want surgery, but she has extra skin. I went ahead and I did CoolSculpting, and I want you to see how her tummy is perfectly flat and the fat is gone. This is 4 months later, and here's the 3/4 view, and here's the lateral view, the same patient. So she has a surgical result with tightening of the skin, elimination of the fat, and no surgery. 2 hours and back to her family, back to her kids. That's amazing. We could never have done that before. Now look at the belly button. Look at beforehand, it's circular, and afterward, you see how it's pulled down? You can actually see not only the skin tightens, but the belly button changes its shape.
This is good.
You know, I would encourage your listeners and viewers to go to freezethefat.com. At freezethefat.com, we literally have thousands of pictures just like this, of people just like you, just like your wife, people in their 20s to their 60s and 70s. This is a procedure that can treat any age group. It's very safe, very effective. Let me show you another woman. This is an interesting story. Another patient of mine, a previous patient, I'd done her face, a facelift, I'd done some breast surgery, and she came in before her son's wedding, and she wanted to have some liposuction. She paid me for the liposuction, but her doctor didn't clear her for the surgery. She still wanted to be thin. So she came back in and we did 6 cycles on her abdomen. So 2 on the lower abdomen, below the belly button, 2 above, and then 2 underneath the breast. And with those 6 cycles, you can see she has an abdominal liposuction-like result. Now, we treated her twice, so that's 12 cycles, and we call that comprehensive contouring. And some people ask me, well, how do you avoid little bulges and little depressions?
Yeah.
We do comprehensive contouring. Well, we'll hook someone up to 4 to 6 different cycles, like I say, in half the time, and we'll shape and contour their body. Randy, I want you to look at something else. Not only is she thinner, but doesn't she look younger? Her abdomen has lost fat, we see that, but she has a younger looking body. You can see a bikini on that, right, in your mind. This, you see a one piece. You see sort of a middle-aged gal. This looks younger. And all she's had is 2 CoolSculpting treatments.
So you were going to do liposuction on her.
She was paid. She was signed up, ready to go.
And because of a medical condition, she could not. You
Correct.
did this. So now people like this that come in, are you more likely to say, hey, you don't need lipo?
I'm a believer now. I have to show them these results. I show them the lipo and I show them the CoolSculpting. Now, some people opt for lipo because they want it fixed now. They want to be done, one and done, out in a couple of weeks and in the bikini and off to Hawaii. That's not, CoolSculpting is not for them.
If this were your own family member, what would you say?
Oh, I'd go CoolSculpting every time. Okay. No risk, no anesthesia, no downtime. I would tell my family members to be a little patient. It's going to take 3 months at least. But, you know, no downtime. Think about the cost savings, just no time away from work. What's your time worth at work? If you have lipo, you're going to miss a few days of work. That costs money. So not only is this a little bit cheaper than lipo, it's much cheaper when you look at the downtime cost. So Randy, though, I've got to let you in on a little secret.
Okay.
You know, we found out years ago after doing thousands of these that if we massaged the area after we took off the applicator, that we could bump up the fat loss by 60%.
What do you mean massage? Like
Yeah,
massage
that's
with your
right.
hands?
Well, when you take off the applicator, it looks like a frozen cube of butter. It really does. And you go to massage it, it almost feels crystalline at first. It's kind of creepy at first if you don't know about it. And so we started doing it with our hands. But frankly, it's cold. And the patients, you know, we'd massage it for 2 or 3 minutes, but we found a really terrific device called the Z-Wave. It's made by Zimmer. So around the office, we call it the fat cracker. It's like a hydraulic jackhammer. It's very massaging. They use it in the physical therapy world for like sore shoulders and stuff. I've been using it on my hands and shoulders at home. But this Z-Wave is unbelievable. It's a true secret here. We actually massage the cold cube of butter, if you will, with this fat cracker, the Z-Wave. The technician's hands are saved. The person getting it done loves it. It's like a gentle massage, and we bump the fat loss by 60%. It's fabulous.
So what are the age ranges of the people that are doing this?
Well, when you think about it, everybody has an inch of fat they'd like to lose, but I'd say the range is, say, from the 20s to the 80s, with most people being in their 30s to 60s. But I've got examples.
80s?
Absolutely. Let me show you a woman here who's 67 years old who came in. She didn't like her bottom, her buttocks, and she really didn't like the lines in her buttocks, as you can see. Well, the cool thing about it, no pun intended, is CoolSculpting not only took the fat away, but look how it tightened the skin of her bottom. You look at her butt, it's much cuter.
Yeah.
She got rid of those horizontal lines. So I've shown you now multiple instances here where the fat is gone. We freeze the fat, but we also tighten the skin. And liposuction does not tighten the skin. Now this is unique in that we not only can get rid of fat, but tighten the skin, get a more youthful buttocks. Everybody wants to, say, lose some fat, but they also want to tighten the skin, and this is a very unique way in which we can do both. So when you ask me, is it as good as lipo? Here's another instance where, in fact, Randy, it's actually better than liposuction.
Now we're going to take a quick break. We come back, we'll start with the arms,
Okay.
and go down, and also what you could do for the thighs. You're watching the Wellness Hour. I'm Randy Alvarez, and we're talking about freezing the fat with board-certified plastic surgeon Dr. Grant Stevens. We'll be right back.
The ideal candidates for CoolSculpting are those people that have stubborn pockets of fat that are resistant to diet and exercise. The love handles, muffin top, so-called spare tire, these are the people that really do best with CoolSculpting.
CoolSculpting only took 1 hour. 1 hour, no general anesthesia, no local anesthesia, no pain. 1 hour, in, out, bing, bang, boom, done.
It's been really nice because I feel like I finally have gotten back the body I had 15 years ago when I was in college, and I didn't expect that from the procedure.
After I had CoolSculpting done and saw the results that I had, I've definitely recommended it to a few people, several people at my gym that have the exact same issues. They work out 7 days a week, but there's still some areas that, regardless of how much they work out, it's not gonna go away.
I feel confident in a two-piece bathing suit. I haven't had a two-piece on in years, and I can walk around with it on. I have a form-fitting dress on, and it just slinks off my body. So when I walk down the street, I feel confident, I feel strong, I feel sexy, I feel beautiful. CoolSculpting is probably one of the best things that I've ever done.
I've had 2 CoolSculpting treatments, and I'm looking to do my third sometime next week. If you decide to do it, I think it's a good investment. I really do.
You're watching the Wellness Hour. I'm Randy Alvarez. We're discussing eliminating fat by freezing it. And it's called CoolSculpting, and it's the next big hot thing. And with us, we have board-certified plastic surgeon, the go-to plastic surgeon in Los Angeles, Dr. Grant Stevens. Dr. Stevens, welcome to the program. You know, I say you're the go-to guy, but people need to know this. Look, my show airs all over the U.S. and all over Canada. I've never met a plastic surgeon, cosmetic surgeon, or dermatologist that doesn't know who you are, or attended at least one of your lectures.
Well, thank you.
I mean, you're one of the kind of innovators. You also teach people this procedure. Mm-hmm. Is that right?
Yes.
For so many procedures. Okay, so you have a lot of I know you're a humble guy, but I had to get that in.
Thank you.
So,
my mom appreciates it.
so arms.
Yes.
You say it's great for arms.
CoolSculpting is
Yep.
great for arms. Yeah. You know, up until now we do liposuction of the arms, but oftentimes the skin doesn't retract quite as well as we like it to. But by using CoolSculpting, we not only get rid of the fat, but we tighten the skin, as I've shown you here on the back and on the buttocks and the abdomen. Let me show you somebody.
All right.
Okay? Here's a young lady, 42 years old. Her arm's a little fuller than she likes. She's in great shape. She says she's got her mom's bat wings. Sounds familiar to some people, some of your viewers. One CoolSculpting treatment right here underneath the arm, and you can see that hammock-shaped area is smooth as can be. It's tight and it's thin. It's
So
great for the arms.
genetically, people that just have like fatty arms.
Yeah, absolutely.
in.
Now, we're not talking about people with obesity. If someone's obese, they need to lose weight. Okay, this is not a substitute for weight reduction. Okay, you don't have to be at your ideal weight, but you don't want to be obese. This is for body contouring for people that are just a little heavy, a couple bulges they don't like on their abdomen, their back.
So if
their
you could
arms.
pinch the fat in your arm, you're a great candidate.
Yes, absolutely. You need to go in and get evaluated. Randy, the thing about arms is a lot of people that are insecure about their arms. You know, you may not know it, but women will wear longer blouses to cover up their upper arms. It's a genetic thing. They may be in good shape, but they've got these bat wings, they call them, or their mom's arms. Sometimes they call them bingo arms, and they're insecure about it. Well, we can now, non-surgically, freeze the fat, make the arms thin, and tighten the skin over their arms. And this is an area that a lot of women are insecure about. But that's not the only one. You know, I'm in the marina. A lot of people want to wear shorts and bikinis and such. Some women have fat around their knees or their inner thighs, and they're insecure and they don't want to wear that short shirt or the bikini and so forth, or their dresses. They want to make them longer to hide their legs. With CoolSculpting, we can non-surgically sculpt around their knees.
Even the knees.
Even the knees. We can sculpt that inner thigh. If their thighs are rubbing, they get a little bulge, and they come in and, Doc, I'm a little insecure. My thighs are rubbing together, but I don't want to have liposuction. We do CoolSculpting. There's also those dreaded saddlebags. You get women, they're in great shape, they're runners, they're healthy, and they've got their mom's saddlebags, and they hate the bulge in their jeans. They just hate it. We can now, with the Cool Smooth applicator, the one I told you about, where you just apply it to the
So it doesn't
side.
suck it in, it's
Doesn't
just
suck
flat?
it in, applies it flat, and we've been approved recently a new colder temperature for that. We did the research for the FDA here in Marina Del Rey, and we can absolutely reduce the thunder thighs or the saddlebags and make them women feel a lot more confident.
Now, so somebody that genetically has a little bit of those saddlebags.
Yep.
I mean, if they do enough treatments, right, you could pretty much wipe it out.
Absolutely.
Is that true?
Absolutely, it's true. Yeah, it may take a couple of treatments, and they're going to lose 20-25% each time. But again, no downtime. Imagine coming in and getting a facial while you're freezing your saddlebags.
You guys do that?
Absolutely, we combine them. You can get a facial, you can get your Botox, you can get your fillers, you can do whatever you want while you're getting the CoolSculpting. We also have flat screen TVs. You can work your iPod. We've got Wi-Fi. We can, give you something to eat or drink. It's a lot of fun.
Now, I know, look, you're all over LA News, always talking about topics. Is this one of the ones that people have the most questions about because it sounds too good to be true? Is it one of those kind of things?
I think the freeze the fat probably generates the most questions because a lot of people just cannot believe that it could be this easy. And so they say, I can't believe it. But thankfully, we have Steve Mason there talking on ESPN, and we've got Steve Ireland, and we've got Beto, and other announcers on different radio channels and different high-profile people that are talking about it everywhere. The other thing is, they've done over 1,300,000 treatments around the world. I've done over 13,000. If it didn't work, a lot of people would want their money back. A lot of people would be all over me. And in fact, people come from all over to have me treat them.
Is that right? Now, you have a fly-in program. Your
We do.
website's impressive.
It's called Fly In for Surgery. I'm blessed. We've had people from 63 countries and all 50 United States, Randy. It's been a wonderful run. And we have patients that stay with us. We've got a whole concept called Patients for Life. And we take care of moms and daughters and dads and sons and so forth.
Now, we are just about out of time. Is there an area of the body we haven't talked about?
Well, let's see. We've talked about the abdomen and thighs and the knees and so forth, the back, but there's another pesky area that you may not be aware of. It's the bra fat area, sometimes called the axillary puff, but it's the bra fat that women can't stand. It sneaks under the bra, sneaks under that the tank top or the bathing suit, and they can't stand it. It's usually here or here. And we have a special applicator we're working with right now to freeze the bra fat. Freeze that axillary puff.
Even on their back?
Oh, around here, yes. That's a little bit different. That's the back fat.
Okay,
I'm talking about the little bit of
so that
little
part
fat
right there
right
by
there.
the arm.
When you've got it, you know you've got it and you hate it. Now you don't because you're not a woman. But a lot of my patients come in, they say, can you help me with this? And we'll do lipo there when we're doing their breast lift or breast augmentation. But a lot of women don't want lipo. They just say, hey doc, can you do that when you fix my tummy, my baby tummy? And I say, sure. We'll do it at the same time. And they get a facial at the same time.
Now, by the way, you're out and about all the time, right? Very recognizable face. People know you from the airline magazines. Do people ask you about this procedure?
They ask me, they stop me on the street. They say, you're that freeze the fat guy. Absolutely.
Because you have like 10 billboards, don't you?
Well, we've got a few in Southern California. Yeah, freeze the fat.
You do things a little bit differently. Almost even more aggressive. I don't want to put words in your mouth, but more aggressive when it comes to like abdomens. Elaborate on that.
Well, we do comprehensive contouring. A lot of people do one and done. They have one machine and they'll do one here, and you're out. I like to assess the whole body, find out where the fat bulges are, wherever, in the front, the back, the top, the bottom, and design a comprehensive plan such that we can do comprehensive contouring or treatment to transformation. You know, if you let me do that and let our staff do that, we can change your entire body non-surgically. It's like that photo right there in front of you. You see how comprehensive that is? She looks thin everywhere, not just one bulge.
So comprehensive meaning you did the top of the abdomen,
The bottom and the middle. So she's had 6 treatments there and she has a bikini body now. And she's well into her 40s.
So age is not an issue here?
Not for me. We're seeing transformations of people's bodies well into their 60s.
Now we are out of time, but is there a particular kind of patient you'd like to see more of that would benefit from this?
Well, I'd like to see any patient that has troublesome fat, something that bugs them, keeps them from putting on a bathing suit or feeling intimate or going out and doing certain things, wearing certain clothes. Someone that's bothered by something, let me help them. Let me take care of it without surgery. No downtime, and we can contour their body and restore their confidence.
Okay, good. I want to thank you for coming on the show. We've wanted you on the program for a long time.
Thank you for having me.
Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.